9:30. In 3, 2, 1. Well, we're talking about heart disease. We were dealing with upper respiratory last week. Now, dealing with the heart. And it's not even February. Isn't February supposed to be Heart Month? That's what
I think it's Valentine's.
Yeah. But hey, the pets don't really understand what that's all about. So let's talk about heart disease.
Yeah, that's like heart or sometimes broken heart.
Yeah, sure.
So much. So speaking of broken hearts, we'll talk a little bit about heart disease and specifically congestive heart failure. Now, last week we talked about upper respiratory infections. Now, we mentioned that the incubation periods are 7 to 14 days. That's an acute cough. Okay, and that's not a cute little one. It sounds all cutesy. No. An acute cough is one that comes on suddenly, and there it is. The heart disease type cough is typically, for congestive heart failure, is going to be a more progressive chronic thing, where occasionally you got a little bit of cough, and then after a few weeks it's a little bit worse. And so when you quiz somebody and say, well, how long has he really been coughing? Well, probably months, doc. Okay, so that clues me in. It's probably not an infectious process, okay? Most common causes of congestive heart failure we see in dogs is valvular insufficiency. Okay. We also see, arrhythmia problems as such, but basically over time, the wear and tear on those valves. That's one of those reasons why we recommend getting dentals done, because the dental disease do cause wear and tear when these bacteria colonize these little flaps. These things are about as thick as saran wrap, okay, if you will, and so a little bit of bacterial colonization can really mess those up. But congestive heart failure, just because they have congestive heart failure, doesn't mean that's the end. There's a lot of things that we can do. There's medications, and when I first got out of school, we would do little things and we'd add on. Nowadays, if you have a dog that has congestive heart failure, don't be surprised if your veterinarian will load you down with 3, 4, maybe even 5 medications all at once. And the reason, there's 2 different rationales. There's a stepwise approach, or Dr. Larry Tilley calls it shock and awe, hit it with everything. He said because in his opinion, you're going to see better results long term. And so we're leaning more towards sending more out than less, initially, and we're seeing good results with that approach. So if your dog's been having that little kind of chronic cough, that'd be a good idea to get him checked for congestive heart failure. Also, don't forget, if your pet's not on heartworm prevention, the #1 diagnosis for a chronic cough in the state of Florida for a dog that's not on prevention is heartworm disease. So if you're not on heartworm disease and you got a cough, absolutely get that checked as well.
All right, and we'll be back right after this.